I think AACE is a very nice meeting in terms of getting a lot of very useful clinical pearls to bring back to your patients, things that can change your practice in terms of experience from experts, data that's being released that's new. I just sat in on a session on the mechanisms of insulin resistance. That was very interesting. So I view this as a very good clinical and a clinical meeting that incorporates more basic science to have a very well-rounded experience at a meeting.
To basically meet up with other endocrinologists across the country, see what they're doing, see if you can make yourself better, make your practice better, make your care for patients better, because you're learning from other physicians. You've got guys that have been around the block for a long time that give you pretty good experience, and their recommendations on how to do things a little bit different than what you learned in training.
A lot of the education that's offered to diabetes educators isn't on this level. Having more backup, I guess, from the endocrinologists and knowing where this information and the reason that they do things and the way their brains work helps us then translate that to the patient. A lot of doctors, don't use layman's terms and rely on people like me, like diabetes educators, to really make it more simple. And I think educating patients just makes our lives easier.
Every physician's different, every endocrinologist is different. There's some of us that are very good and there's some of us that are not so good. And I think the ones who are not doing good enough need to get better. I think the ones that do a very, very good job with patients, what they know, need to keep it up. And you always have to kind of come to these meetings to stay abreast on things we're supposed to know. All physicians are different and their interests are different. How they go about doing things is different. So it's case by case basis. I really don't have an endocrinologist I trained under who I want to be. I actually want to be different from them because there was things that they would do or the ways they thought I didn't agree with, and you got to use your own head and figure out how do you want to treat your patients and do the best that you can.
One of the things that I've taken from, for instance, 2diabetes.org, that is a wonderful site, and I took their message of this is your diabetes, and I present that to my patients, is that I can offer you the tools and experience and advice and recommendations, but on a day-to-day basis it's often the patient that, or certainly it is the patient that's making the decisions that lead to either good control or poor control. So I think physicians who don't leverage the patient's interest or ability to take hold of their diabetes on their own are missing a huge part of diabetes management. Now we're moving towards, I think, professional endocrinologists, clinical endocrinologists, and the organizations recognizing the importance of technology, both in terms of devices and downloading pumps and meters, and but also the value of social media and engaging your patient in management of their diabetes.
Use good information, come into visits with questions, knowing something about what they have problems with, but try not to learn too much, because there's a lot of good information that's out there, there's a lot of bad information. So patients need to do what they come to us for recommendations, they come to us for treatment. I think they should try to go with what we recommend, and then if it works, keep doing it. If it doesn't work, let the doctor know, and then we got to find a different way to do it.
A lot of patients with insulin pumps and sensors, and often people are unaware of, for instance, the use of the more advanced features like combination boluses or using temporary basal rates. And so I think being engaged and reading about different options available for getting the most out of your life with diabetes. Most important treatments that we can offer for diabetes that's overlooked often. And we often, we give it lip service, but exercise to me is medicine. And if we don't at every visit and at every time we get the chance, encourage people to exercise and give them recommendations in terms of integrating exercise into their diabetes management, then I think we're really missing a huge aspect of improving the lives of people with diabetes.